Hi, this is Dr. Jim Anderson from Anderson Podiatry Center for Regenerative Medicine, here to talk to you a little bit more about regenerative medicine and what that might look like for you in terms of how much you're laid up. That's one of the true advantages of this kind of treatment, is how little you're laid up, and you can really get back to full activity maybe a lot quicker than you might think. And again, it's very nice in that you oftentimes may be able to delay and even eliminate, in many cases, the need for surgery. And that's why we're so excited about this, and we've been doing it now for quite a while, about 5 years. But you can kind of break this down into two kind of layup periods of time. Probably the patients that have the treatment of regenerative medicine for arthritic pain have the least amount of layup. And basically, when they're laid up, let's say it's for a big toe joint that's painful, and we might use a regenerative product in this area. Usually we're just going to put them in a surgical shoe like this. There'll be just a Band-Aid over the area, and that's it. And they walk out with this on, maybe wear it for 2 or 3 days, and that's it. If the patient wanted to run in 5 days or whatever, they can do that. It's not going to have a negative effect on the outcome of the treatment process. But you'll hear us talk about a surgical shoe, and that's basically what this is. So you're in a stiff-soled shoe. Sometimes if I treat arthritis more back by the ankle, or one of the larger joints in this area, we might even put you in a larger one. Or maybe if we do a couple joints, this is called a cam boot. And this would go all the way up to the knee. And again, you can ambulate, you can walk immediately in this, and it's really not too big a deal, maybe 2 or 3 days in this. So either one or the other, but more times than not, we're in this. Now, probably the treatment with regenerative medicine that lays you up the most would be if you have chronic heel pain. If you have plantar fasciitis here, heel pain is called plantar fasciitis, and you can refer to another video in regards to that. Or if you have tendon tears or tendonitis, there's a tendon here, and then on the outside of the foot, when we're looking at Brittany's foot, there are 2 little tendons over here that actually help stabilize your ankle and your foot from moving side to side. When there is a tear involved, or when there is the plantar fasciitis involved, we're usually going to treat you by having you walk in this, usually a minimum of 2 weeks, okay? So again, it's not a surgery, and you can walk around as much as you want, but this is what you're going to be in. You don't have to shower with it on, you can go to bed without it on, and when you're just sitting around not bearing weight, you don't have to wear it. So I want you to realize that, because time is so precious for so many of us, and I really want to emphasize how little you're laid up when you have these procedures done. So very exciting news, and if you have any more questions or would like more information, please give us a call at our center, or just look us up online at AndersonPodiatryCenter.com and look under Regenerative Medicine in our website. Thank you.